You can see here beyond that, you've got a yeast overgrowth can happen in all of these tissues, the sinuses, the oral cavity, the GI tract, the vaginal lining, and the skin. You can get yeast growing on any one of these areas. And again, if it's happening in the gut, you can get the gluten mimicking symptoms, okay, which we just talked about. But there's another side effect here that I want you to understand, and that's oxalate intolerance. Now, I just talked about oxalates. You can check out my crash course on the topic. I've also interviewed some of the world-leading experts in oxalate toxicity. You can check out some of those videos. But in short summary here, oxalates can create a lot of damage. Oxalates are chemical byproducts of yeast overgrowth. Yeast can produce oxalate. And so if you have a yeast growing inside of you, an overgrowth growing inside of you, they can actually produce oxalate. And so now that oxalate, which is like tiny little glass shards, can lodge into your different tissues. It can cause joint pain. It can cause vulvodynia. They can cause kidney stones. Oxalates can cause skin inflammation. Oxalates can cause liver damage. There's a host of different conditions, inflammatory issues that arise as a result of oxalate excess. And so again, aside from mimicking gluten, yeast can also produce oxalate that can lead to symptoms as well. And that's not all. This is a big one. Yeast can also contribute to Auto Brewery Syndrome. So this is a situation where you eat the carbohydrate, the yeast inside your bowels say thank you for the food, right? And they digest that carbohydrate and convert it into alcohol. Hence the term auto brewery. Your gut becomes a brew factory, a wine factory, a beer factory. And this is where, if you've ever seen people that are chronic alcoholics, a lot of them have that, what we would call classic beer belly, right? Where their guts stick out. This has to do with this right here. Most of those individuals they've been feeding yeast by over-consuming alcohol for so long that they actually have a gas byproduct. Yeast can produce methane and hydrogen gas, and this is what can cause a lot of the bloating that people experience. It's also common that people with auto brewery, I've seen them where they've been diagnosed with something called SIBO. SIBO stands for small intestinal bacterial overgrowth. And a lot of times I see this as a misdiagnosis when in fact that person has not a small intestinal overgrowth of bacteria, but a small and large intestinal overgrowth of yeast colonization. And so that we're getting that same kind of symptomatology that we might see in SIBO, which is heavy IBS, with gas and bloating, intestinal distension, etc. So, auto brewery, how does this happen? If you want to know the chemistry, the science, this is a mechanism by which yeast and other bacteria, because some bacteria can do this as well, can produce alcohol. So this is the cell membrane of the bacteria, of the yeast in this case. So you get glucose coming in here, and it goes through a number of chemical reactions, but ultimately the final common pathway there is ethanol, which is alcohol. And so that alcohol then can create a host of different types of problems, just like regular alcohol if you're drinking it. So let's dive into this concept a little bit more. So again, auto brewery syndrome, sometimes also referred to as gut fermentation syndrome. Okay. And this was a really good review study published here recently. 17 case reports consisting of 20 patients diagnosed with gut fermentation syndrome. The species that caused it, you see here, Candida albicans, Candida glabrata, Saccharomyces, in this case cerevisiae. This is sometimes referred to as brewer's yeast. A lot of you ask me about using nutritional yeast as a B vitamin supplement, and this is one of the reasons I'm not a fan of using yeast for B vitamins, adding yeast to foods or using it as a supplement, because so many people have yeast overgrowth and don't know it, and taking that kind of yeast can actually compound or increase the problem. But you've also got Candida intermedia, Candida parasilosis, and Candida kefir. So these are all different species of Candida, at least in this review, where they found these types of Candida could generate alcohol and create gut fermentation syndrome. Now, they also found a bacteria that could do it and reported on that, and that bacteria, it's a gram-negative bacteria called Klebsiella pneumonia. This, by the way, is one of the most common nosocomial infections. What does nosocomial mean? It means hospital acquired. People go into the hospital, whether you're the patient or whether you're visiting the patient or taking somebody who's you love to the hospital and you're visiting them. This is where you can pick up infection while you're in the hospital, because a lot of these microorganisms hang out there. They live there. Klebsiella is one of the richest in the hospital air, in the air environment. And so people can pick it up. I see this on a really frequent basis. This is also a very common bacteria that grows along with environmental mold. So a lot of times when we see water damaged buildings, we'll see a lot of yeast, or more specifically, we'll see a lot of mold like Stachybotrys, as well as molds like Fusarium and Chaetomium and Aspergillus and Penicillium. But we'll see not just mold in these water damaged buildings. We'll see Klebsiella as a gram-negative bacteria growing with them. And I see a lot of cases where people are in mold and they have Klebsiella, but they also have Candida. And so they have these microorganisms in their gut that are creating fermentation of carbohydrates. And so these people are walking around making and producing their own alcohol. And there, of course, there are a lot of there's a lot of potential problems with making your own alcohol, and one of them would be if you're driving your car, if it's bad enough, if you have gut fermentation syndrome bad enough, you could blow above the legal limit on an alcohol test and be accused of driving drunk. And so you can see here, they're calling this process rare. You see rare and underdiagnosed. So what is it? Is it rare or is it underdiagnosed? Because if it's underdiagnosed, is it really as rare as they think it is? My experience is it's not rare at all. It's extremely common, but it's extremely underdiagnosed because nobody actually does testing. Who does testing? How many of you have ever been to the doctor where you were having some of these symptoms we've been talking about, and they did laboratory testing for any of these types of Candida, or they did a carbohydrate challenge test, or they did bacterial or fungal testing? Most of the time you go to the doctor, they'll do this. Endoscopy is a very common procedure, but these other things are not really performed. And so how are you going to diagnose it if you're not performing tests to help you understand it and identify it? And that's why I don't think it's rare. Again, in my experience, it's not rare at all. I just think it's underdiagnosed. So at any rate, let's look at some more research on this. Okay, so this is another study where they published a number of cases and the symptoms associated with Auto Brewery Syndrome. So this is, again, highlighted in the center section here are the symptoms linked to auto brewery. So symptoms: memory loss, mental changes, depression, seizures, slurred speech, poor coordination, slurred speech, fatigue, stumbling, dizziness, nausea, unexplained GI discomfort, intoxication, dizziness, slurred speech, episodes of drunkenness. How many, look, you think about, look at a lot of these symptoms. Memory loss, loss of clarity, dizziness. Does that sound like anything we see a lot of? Alzheimer's disease, dementia, where these people are losing their balance and they're more prone to falling and they don't have very good memories. That's what alcohol does, right? So keep going. Episodes of drunkenness, loss of balance, slurred speech, passing out, gastrointestinal distress, excessive intoxication after minimum or no drinking, the cheap drunk, right? The person that says, I only need one drink and I'm drunk. Walking erratically, bizarre behavior, abdominal pain, bloating, mental confusion, bizarre behavior, somnolence, disorientation, faintness, nausea, vomiting, comatose, difficulty in articulation. That describes a huge chunk of the population. Blurred vision and staggering gait. Now, these are all symptoms of Auto Brewery Syndrome. These are the causative agents here on the left. You can see these are all just the different types of microorganisms. So Saccharomyces cerevisiae, which is, again, a type of it's brewer's yeast. It's what they make alcohol with. Candida albicans, Candida parasilosis. You can see here Klebsiella, the bacteria we talked about a moment ago. There's another kind of bacteria, in this case, called Enterococcus fecalis. And then Candida again, Candida, another kind of Candida here, multiple forms of Candida here, Saccharomyces here, Candida and Saccharomyces here, Candida and Saccharomyces here, Candida and Saccharomyces here, and then 2 Candida albicans. So these are all, again, case reports where the symptoms, this is what the patient presented with. These were the different microorganisms they tested and actually found, thus confirming a diagnosis of auto brewery. Now, auto brewery is not just restricted to your gut either. You can see here there's a GI variant, but there's also a urinary tract variant. So the same thing can happen in the urinary tract as well. And so again, you see here the microorganisms responsible predominantly are these top ones here, and then the ones that are underlined from here down. These are ones where no cases were found with these microorganisms. In other words, these microorganisms are safe. And actually, one of the things that we like to use in people that have this is a bifidobacterial probiotic, because again, what increases the risk for the development of yeast overgrowth or candida overgrowth in the first place? It's antibiotic use causing a reduction in different types of bacterial species of the GI tract, and bifidobacter being one of the most important ones. So again, treatments, what are they? Again, this is from research study, low carbohydrate diet. You look at how many people are going keto and how many people are going carnivore. Because you can go gluten-free, and gluten-free diet is not necessarily a low-carb diet, but these are both low-carb diets. And so how many people are responding to these diets because they actually have a form of auto brewery? Maybe it's not to the point where they're walking around feeling drunk every day, but there are stages, there are levels of this auto intoxication that can occur. And so they're benefiting tremendously as a result of cutting this out, because by cutting out carbs, you cut back on the fuel source for yeast to overgrow with. You're also treating with probiotics and antifungals. A number of these are antifungals, fluconazole, nystatin, amphotericin B, and then antibiotics in the case where you have something like Klebsiella because it's a bacteria, right? And then these authors of this research study were recommending fecal microbiome transplants. In my experience, you don't need to take it that far. Really, these things here usually work really, really well. And then again, the diagnostics, it's lab testing. It's blood, urinary, breath, alcohol levels. It's carbohydrate challenging. And it's culturing, right? Bacterial and fungal testing. And you got to do that. The way you have to do that is you have to culture. Because, again, how many of you have been to a GI doctor where they've done a scope but they've never done a culture? Where they didn't actually take a poop sample from you and culture out to see if it was growing these microorganisms. It's such a rare thing to see a GI doctor do a culture. In my experience, it just doesn't happen very often. And usually when they do a culture, they're doing a parasitology culture, so they're only looking for parasites. They're not looking for yeast, and they're not looking for these different bacteria often. Now, I took this directly off the National Institute of Health website because I just wanted to show you a comparison. Alcohol-associated organ damage. So this is chronic alcohol use. And so you get cardiac arrhythmia, cardiomyopathy, heart disease, high blood pressure, cancer in the throat and mouth, fatty liver, fibrosis, cirrhosis of the liver, alcohol-associated hepatitis. Like, these are all possibilities within the realm of candida overgrowth because of you're making your own alcohol. Even if you're not an alcoholic, GI problems. Look, gut leakiness, leaky gut. I love this because So many doctors will say there's no such thing as leaky gut. Here we are in National Institute of Health website. What do we see here? This word gut leakiness. What is that? That's the leaky gut. Microbial dysbiosis. That's an imbalance of the types of microorganisms growing in the gut. And then colon cancer. Neurologic problems, stroke. And as I showed you earlier, yeast overgrowth in mouse models increasing the risk for the development of multiple sclerosis. But also, what were some of those other symptoms of yeast overgrowth that we showed you earlier? A lot of those are matching up. Lung, you get shortness of breath, respiratory distress, pneumonias. Muscle symptoms, you get muscle pain or damage, and then muscle wasting, right? So, in the elderly, what do we see a lot of in the elderly? Their muscles dwindle, and this could be one of the reasons why that's happening. We get pancreatic dysfunction. We get bone problems, reduced bone density, as well as impaired healing or repair. But ultimately, you can see down here, you get immune dysregulation, which is why we're talking about autoimmune and candida, right? Because, again, if the candida is producing the alcohol is creating the immune dysregulation as well. And then from that, you can also get cancer. Remember that cancer is end-stage autoimmune disease. So you have autoimmune disease for a few decades. The next consequence is the end stage of that, which is a number of different cancers. As you can see here, liver, colon, breast, oral cavity, and rectum cancers all linked to chronic alcohol exposure. You don't have to drink the alcohol. You can chemically produce your own if your microbiome is imbalanced. If you have a history of antibiotics, if you have a history of oral steroids, taking steroids for immunosuppression, or taking other drugs that suppress the immune system, or taking antacids, or taking anti-inflammatories, or taking antihistamines for long periods of time in your life, these classes of medications can all suppress immune function, leading to an increased risk for candida and other yeast overgrowths, which can cause lower levels or lower degrees of auto brewery, where you're now making your own alcohol on a regular basis. And as you make your own alcohol, you increase your risk for all the problems associated with chronic alcohol exposure.